So good morning or good evening or good afternoon to everyone. I'm Alfio Albazini from Switzerland. In my clinic here in Switzerland, my clinic is here since 25 years. We are dealing with different musculoskeletal components.
Physiotherapists are very much the group that we are thinking of. But what about private trainers? Can they use this too, do you think?
Yes, I think, look, I have, for example, a personal trainer who is coming in my clinic in the gym, and he does his training with some patient who require that. Normally, the problem is that some patients, they cannot really exercise alone. They are not motivated. They need a personal trainer who tell them, do 10 reps, one more, two more, and they stimulate them. And I think personally, if they're good, they have some very good ideas about how to exercise. And I think even as physical therapists, we could learn from them because they have really, if they are good, they have some really amazing ideas. If we would tell them to use the EMG, I think it could help them in this way. Basically, I noticed that personal trainers, they are not trained like physio, who has maybe a better knowledge about dosage if we are speaking about pathologies. They load normally a little bit more, or they tend to load a little bit more. So I think if they would start to use an EMG which is giving them a feedback, they would have something as a measurement which would probably help them a little bit in the way that they would maybe load less the patient if necessary, or that they could load more if they want more. But I would say, speaking personally, because of my coach I have here, normally he tends to do more rather than less. Why? Because maybe use more with the athletes where they push, but even the athletes, sometimes they are injured. You cannot push them as much. You have to do what we said before, a little bit quality before, and then start with the quantity. So I think personal coaches, trainer, they could really use it in a good way. I was thinking also about a second possibility about coaches. Also, if you think about coaches of specific sport activities, they could really use EMG to analyze movement, because sometimes we know that the quality of a movement is maybe not as good. I'm thinking, for example, a tennis player is doing a serve, maybe cannot hit the ball at 200, it's less, he started to have pain. Coach could analyze how the muscle is working in the different phase of, for example, a service, and that could help them to compare what is going on maybe before, when they are off season, when they are not maybe playing much and they don't have any pain, compared to maybe during the season where they start to get a little bit tenderness, maybe a little bit of irritation. They could really make some judgment and think about, how can I change this movement? How can I train the muscle which is maybe a bit weaker?
And I was thinking about, like, in strength training, when you are thinking about a specific muscle, I guess that would be the task of a personal trainer to strengthen up a specific muscle. Then you could also get a feedback if you are getting the maximum out of it or not.
Exactly. Especially because if you want, for example, retrain something, you had a problem, and normally the athletes, they are with the physio, but after a certain level, they go to a coach, to a fitness trainer. And if you want to achieve again the maximal contraction, voluntary contraction, or maximal power, you need to have like something to compare, a parameter. And this would be obviously great that they can say, okay, on the left side, we have done much. Maybe it's not the non-dominant side, but at least with this one, we have to get there, even maybe more. And then they have a parameters that they can continuously monitor, assess, and reassess to see whether they're getting better.